Alright, hi guys, I'm back again. If you hear people talking in the background, it's my family and stuff. Of course, we're all homeschooling children and stuff here, and my husband's putting in a new washer and dryer, so God only knows what you might hear. But let's go through some scoliosis here and see what we can learn. We all know who has been the most with scoliosis has been Princess Eugenie. One of the reasons why she wore a wedding gown without a back was so people could see her scoliosis scar where they opened her up and put rods in to try to straighten up her back. So if you want to go and find pictures, supposedly you can see her back and see the scar where they fixed her scoliosis. Okay, so what is scoliosis? It's a medical condition in which the patient's spine is curved from side to side and may also be rotated. So not only is it curved, I'm going to draw my little thing here. Okay, so a curve, but it can also be twisted too. So you can have a curve with a twist. It's an abnormal lateral curvature of the spine, and it may look like an S or a C. So you can have an S-curve scoliosis or a C-curve scoliosis. Scoliotic curves greater than 10 degrees affect 2 to 3% of the population. A lot of people have scoliosis and they don't know it, or it doesn't affect them. The prevalence of the curves less than 20 degrees is equal in males and females. Greater than 20 degrees is more prevalent in females. Curves greater than 20 degrees affect 1 in 2,500 people. Curves to the right are more common than curves to the left, and a single C is more common than an S curve. So the most common form is an adolescent idiopathic scoliosis. It happens. We don't know why. It's nothing that is genetic. The mom didn't do anything wrong. Nothing happened during delivery. It's just the way they grow. Hereditary, there's been no direct link, although we do see some scoliosis in families. We could get what's called a tethered spine syndrome. A tethered spine syndrome is basically where the spine is tethered together and it doesn't move. So a spine is supposed to be able to move as we move, but it stays. So there's no going to the side and stuff because it's like tethered tight like a rope. In 2007, the researchers at Texas Scottish Rite Hospital for Children identified the first gene associated, and this is the gene. However, they don't know what the gene does or what it expresses to cause this. Okay, sex. Curves in girls more likely to worsen as they age, especially as we age and we get osteoporosis and such like that. Age, the younger the child when the scoliosis appear, the greater chance their curve will worsen as they grow. We all know that when our kids go to school, in elementary school, they're screened every year for scoliosis screening. Size of the curve is the risk factor for it getting worse. Location, curves in the middle or lower spine are less likely to worsen than curves in the upper spine. And I'm talking about thoracic spine. So the curves in a thoracic spine are more likely to worsen as opposed to a curve in the lumbar spine. Or if they have spinal problems at birth, such as spina bifida, cerebral palsy, or any of those others. Okay, so these are the classifications. We have partial. So this is partial. You can see how some of the discs are a little bit malformed. We have complete. Do you see how this disc is really malformed? Unilateral failure. Basically, you see right here, the spine, these are not vertebrae that come in. This is more of a tethered spine type thing. And of course here, we have a block of vertebrae. We basically don't have vertebrae. We just have a block of bone. So we have dextroscoliosis, which is scoliosis, and the convexity is the right side. Levo is convexity to the left, levo left. And roto refers to scoliosis in which the rotation of the vertebrae is particularly pronounced. A person can have this and the above. You can have all of these, and you'll see pictures later on about it. All right, so this is dextro, right here. You see how this curve goes out. We have levo down here. The curve is more towards the right, and you see how it goes off this way. Now we're going to talk about when we assess. See how this picture denotes that the shoulder blades are uneven and the shoulders? That is why we assess for them. Okay, this is roto. Basically, it goes left. Here we go. It goes to the right. It goes to the left. And how the hips are turned, the spine rotates too. And we have a C curve. So you see it's called just like a C. Okay, these are just also pictures of them, of different forms of how you can look at them. I like diagrams. I think that makes it easier for you guys to understand. Okay, so forms of scoliosis. We can have infantile scoliosis. Means that it's diagnosed in a child between the ages of birth and 3 years old. We also know that when we get to cerebral palsy, you know, a child can be diagnosed with cerebral palsy up to 2 to 3 years of age. Same thing with scoliosis. Congenital, it means that it's the first weeks of embryonic formation. So, and that's actually a 5. The first 5 weeks of embryonic formation when the spine is being formed. Juvenile scoliosis, defined as scoliosis that is diagnosed between the ages of 4 and 19. My husband was diagnosed with mild scoliosis when he went to have his Navy physical when he was 20 years old, or 19, I don't know, a long time ago. Anyway, and it accounts for 10 to 15% of the idiopathic forms. So adolescent scoliosis is scoliosis that is diagnosed between ages of 10 and 18. Can be due to cerebral palsy, muscular dystrophy, genetic spina bifida, or developmental. The spine just doesn't want to grow. We come out as a perfect baby, and for some reason the spine says, I'm not growing anymore. And we go from there. And of course, in adult neuromuscular scoliosis, this results in a neuropathic or myopathic condition, meaning is that we see women who have, or adults who have multiple sclerosis or muscular, just one of these that will actually develop scoliosis due to the muscle wasting disease that they have. All right, so adult neuromuscular scoliosis. This is a 40-year-old male with cerebral palsy and spastic quadriplegia right here. We have, 40-year, right there. A 19-year-old female with myokyphoscoliosis. You see, we have, if you could really see, you have a C, and then it's an S curve also. Now, don't you think that this is going to really play a role in the breathing? So these people tend to get a lot of pneumonias and stuff because they can't take a deep breath in because their spine doesn't allow for it. And then this is some of the orthotics that we use for these people in here. Now you're going to say, but wait a minute, Dr. Grundon, if we strap them in, that's a restraint. But it's something for safety. So there's a restraint to tying a patient to the bed, and then there is orthotics that actually keep a person in their wheelchair. There's it's a fine line, and I know some of you are in your mind going, that doesn't make sense to me. But this is not considered a restraint, putting them in and securing them into their wheelchair. All right, symptoms of scoliosis. Basically, we talked about uneven musculature on one side of the spine. Okay? When you look at it for this, their shoulders are unequal, their shoulder blades are unequal, or you just notice that their back is a little bit skewed. A rib hump or pronounced shoulder blade. Basically, you see, if you stand to the side, you see a little bit more of a curve. Uneven hips or shoulder levels. In women, asymmetrical size or location of the breasts. Unequal distance between arms and body. So if you have one arm that goes way down and the other doesn't. Their clothes don't hang right. They have slow nerve conductions. Or these people are fatigued a lot because they have to use a lot of muscles that aren't meant to be used for certain things that they're doing in order to, for their ADLs and such. All right, so assessment. We're going to do annual checkups. We do the school screenings between 5th and 6th grade because these are our growth spurts for people. We do an Adams Forward Bends test. And you see this hump right here? So when you go through and you see this, I always go and I take my fingers and I sort of rub it all the way down to see if I can see a little curvature and stuff. Screening hints. So shoulders different heights. Head is sort of not equal. Hips are not equal. Rib cages are different sides. Uneven waist. And just a change in what the body should normally look like. I know this is fast, but I need to keep these recordings a little bit short. So again, physical examination. I gave you this as a checklist. A height measurement, gait, foot shape, skin, assessment of pubertal development, and you can go through on all of this. All right, so we're going to look at a physical exam. Adam's bin test. Skin for cafe au latte spots, basically Mongolian spots, dark spots, because those are also signs of spina bifida or spina bifida occulta, which means that there's a change in the spine. Either vertebrae did not completely form or fused or something. Feet for calcareous deformity, and you'll know what that means when we go into club foot. Abdominal reflexes, muscle tone for spasticity. We're also going to do x-rays, weight bearing, meaning is that they're standing. AP from the side, coronal lateral, all of those. And they might do these for a year or two just to monitor the degree of to see if it's getting worse. And of course, a Cobb angle measurement. I do not expect you to know how to measure a Cobb angle, but I expect you to know what the word or term means. So a Cobb angle is used to assess the curvature. Basically, it's geometry. If there are two curves, each curve is followed separately. You don't know it, you don't need to know how to do the math, but you need to know what a Cobb angle actually is. What it means, the term means. All right, so this is how a Cobb angle, you can look at that. Okay, so treatment, what are we going to do? Well, we can observe it if it's not too bad. We're not going to just immediately go in and start putting braces on these people's back or rods or anything. We can do bracing through surgery. Observation is usually if it's less than a 10% curve. Bracing is done when the patient has bone growth remaining. So if they're young and we catch this when they're 3 or something, they might go on and start bracing it or be a little bit more aggressive with interventions. A TLSO brace worn 22 to 23 hours a day. Kids don't like this. We used to do plaster jackets mainly for infants, but these are going away since we have better orthotics. But every once in a while, I've actually seen like 10 of them in my career, so some people still want to use them. All right, so if the scoliosis is suspected or diagnosis, will require first screening 6 to 9 months. If the Cobb angle is greater than 10 degrees, diagnosis of scoliosis. If the Cobb angle is 10 to 15, requires frequent screenings. 20 to 40 requires a brace. Goal, prevent the worsening. Some braces are worn all day, some are only worn at night, depends upon the angle. And if it's greater than 40, they're probably going to go have surgery, which means putting rods on the spine to straighten it. These are some of the braces that people wear. This is a plaster cast. TSO jacket, Milwaukee brace. All right, so if they're going to go have surgery, a spinal fusion. This is usually what they're going to try to fuse the spine. Usually if they're adult or a teenager or something, not a 3 or 6 month old, unless it's really bad. The surgery entails grafting bone to the vertebrae so that when it heals, they will form one solid bone mass and the vertebral column becomes rigid. They can still move, but it's rigid to keep it into a straight line. Usually we have great outcomes. We're doing surgery on the back. Sometimes things happen. Patients can participate in sports. They have natural childbirth and are generally satisfied with them. Usually if this is successful, they go on to lead normal lives, no problem. All right, and you saw this earlier. This is basically, they're going to put these rods in. They're going to fuse all of these things together and put the rods in. All right, so complications of scoliosis, well, lung and heart damage. Severe cases, a curvature of more than 70 degrees, the rib cage may press against the lungs and heart, making it difficult to breathe, like in that one girl I showed you that had such a really severe C curve. Thoracic insufficiency syndrome, which is inability of the thorax to support normal respirations or lung growth. We see this with people who get like a tethered spine syndrome with ankylosing spondylitis who don't take their medicine and such. They can have back problems and of course body image. I mean, if you're curved and you're sort of, you could, people look at you weird. It's sort of like, I could not stand watching the movie The Hunchback of Notre Dame because the guy had severe scoliosis. It wasn't his fault, but yet his life was miserable, and it's just not one of my favorite Disney movies. All right, so nursing interventions. We monitor the progression of the curve. They're going to come to you. You're going to monitor it. You're going to make sure the x-rays. Educate the child and parent. Educate the parents for possible surgery. So if the child has to have surgery, when they come out of surgery, we're log rolling them. Proper body alignment. We're going to do neurovascular checks status continuously. Pretty much every time we go into the room. We are going to encourage cough and deep breathing. We don't want to get pneumonia, especially if they're having a hard time taking deep breath ins, which they are because it's going to hurt for them right now. We just screwed with their spine. It's going to hurt to take a deep breath in. We treat the pain as needed. We monitor for incontinence. But now remember, we're going to treat for pain. We're going to constipate these people, and they're not going to have the back muscles and lumbar muscles to really push out the feces. Monitor for superior mesenteric artery syndrome, such as throwing up, abdominal discomfort, and they may have some activity restrictions during the healing process, but once it's healed and they've done physical therapy and stuff, everything is going to come out fine. Okay, I know this was quick. Again, email me, text me if you have any questions at all on this, but I've gone over the test and I've made sure that everything that's on the test is been said from my mouth on these tapes or it is on the PowerPoint. Do not forget to look at the notes pages under the PowerPoints because I have certain things written there too. All right, the next thing we'll probably end up doing is joint replacements.